Good morning. Welcome, everybody. Thank you for joining our department seminar series. Today, we are delighted to have with us Prof. Seth Guikema, an outstanding educator and a scholar. Seth is a professor in the Department of Industrial and Operations Engineering and Civil and Environmental Engineering at the University of Michigan. He's also a professor in the Department of Safety, Economic, and Planning at the University of Stavanger in Norway, and a data science research fellow at One Concern Corporations. He was the president of the Society of Risk Analysis in 2020 and is the area editor for the natural hazards area of the journal Risk Analysis. His research focuses on risk analysis, particularly at the intersection of behavioral modeling, machine learning, natural hazard, and equity. Without further ado, Seth, please take it away.
Helps if I unmute, sorry. Thank you, and thank you for organizing. And just one quick announcement that the natural hazards area of risk analysis is a new area. So if you have natural hazards work, we would love to see papers there, and it's intended to be very interdisciplinary. So with that, I will share my slides and we'll jump in. Can everybody see slides okay?
Yes.
All right. So today I'm going to be talking about some of our work looking at inequity, injustice, and risk in urban areas. And I'm going to do this through a series of 3 very different case studies. And first, we'll talk a little bit about these terms and then jump into some of the work we've been doing. One is on redlining, and I'll explain what that is if you're not familiar with that. Then a second study that we've been looking at human sex trafficking and the impacts of the COVID pandemic, and then talking about inequities and community resilience to hazards. So 3 very different topics, and use these to try and look at some common threads when we think about inequity, injustice, and risk in urban areas. So we need to think a little bit about the terminology we're using. So equality versus equity, and I like this kind of cartoon explanation of it. So on the left side, everyone is assumed that they'll benefit from the same supports. That is, you give everybody a box of the same height, so you give everybody the same thing. So they have equality in what they get, but you don't have equity in the outcomes. In the second image, you give more support to those to give them equal access to observing the game. And then in the third image, you remove the systematic barrier, which is the big wooden fence. So you remove the barrier rather than trying to get them over the barrier. So when we think about terminology, we have to be careful with what we mean. So a few definitions, and these are some dictionary type definitions, right? So an inequality is differences in size, degree, circumstances, etc. Inequity is a lack of fairness or justice. Those 2 are not the same thing. And sometimes they're used interchangeably. We have to be careful there. And then injustice is lack of fairness or justice or an unjust act or occurrence. So I work a lot in the area of natural hazards. So let's think about these in terms of access to resources within a community after natural hazard. And this is that third case study that we'll come back to. So inequality would be differences in access to resources. Let's say your resource is food and you want to look at access to food or sources of food after a natural hazard. So inequality would be differences in access to resources. Inequity would be access to resources that's not in line with what's actually needed to achieve equal ability to provide equal ability to achieve your individual potential. And then injustice would be inequitable access to resources due to an unfair or unjust act. So we have to keep this distinction between equality and equity in mind as we talk through this. Okay, so I'm a risk analyst. So let's talk a little bit about risk, right? Because we're also talking about this in the context of risk. When we think about risk analysis, we're really trying to answer 3 questions, but it's usually expanded to 4. So kind of the original idea is what are the possible outcomes? So what can happen? How likely is it? How bad is it? How much do we care about the outcomes? And then we usually extend this and say, well, what can we do about it? That's the risk management part. So risk has to include both some measure of the uncertainty, the likelihood of the outcomes, and the consequences of those outcomes. And then managing risk involves balancing many competing goals in any given situation, and these can vary a lot depending on what the situation is that we're talking about. Okay, so a thought experiment to help you think through this. So this is associated with that human trafficking example that I'm going to talk about. But let's say that law enforcement responds to a domestic violence call. They remove the female victim from the situation, do not charge her with any crime, and then provide her with phone numbers to call for support. Let's consider 3 situations, and in each one, ask yourself, is this outcome equitable and is it just? In the first situation, the victim is there on a Tinder date gone bad. She has her own apartment and a support network. In the second, the victim is there on a paid date as a commercial sex worker. She has her own apartment and support network. And on the third one, the victim is a human trafficking victim. She does not have an apartment, has limited support network, and has limited resources. And in all three cases, she's been treated equally, right? So they get the same treatment, but is this an equitable outcome? So you can consider that and think about, okay, well, what makes it equitable or not in this type of a situation? So that helps illustrate this difference perhaps between equality and equity. Okay, now I'm going to jump into some of the research that we've been doing. The first case study was just came out in the Journal of Applied Geography this week. And Anna White, one of my PhD students, is the lead author, and Tom Logan is a former PhD student who's on this as well. So here what we're looking at is patterns of discriminatory housing and comparing them to outcomes that we see in cities today. So over time in the US, we've had housing discrimination that was considered legal and thankfully is no longer. But it started off with racially restrictive housing covenants, deed restrictions based on race, and things like neighborhood improvement organizations. So these were considered legal, and they would keep certain races out of certain parts of the city. At the institutional level, we had things like refusal to grant mortgages and loans, increased interest rates or down payments to try to keep certain people out, and then redlining. And we're going to talk more about redlining. So what is redlining? Well, the federal government, through the Homeowners Loan Corporation in the 1930s, would take a city, and this happens to be Birmingham, Alabama, and they would go block by block and determine a grade for each block: red, yellow, green, or blue. And there's terms attached to these. And then this was helped guide whether or not you could get a mortgage in these areas. So you have what they termed a residential security map. And the green areas are hotspots for growth, new well-planned sections of the city. B, were completely developed. They still are good. Remember, this is done in 1938. So it's like a 1935 automobile. It's still fine in 1938, but it's not what people are buying today who can afford a new one. C, characterization, and we've added the bold here, characterized by age, obsolescence, or change of style, or infiltration of a lower grade population, by which they often meant Black or Jewish or sometimes some other immigrant populations. And then D, characterized by detrimental influences in a pronounced degree. So this is primarily not a white neighborhood. So this was very institutionalized housing discrimination. So what do we actually know about the effects of this today? Well, there's been studies of how those historic redlining from the 1930s are still reflected in patterns in cities today. I'm not going to go through these in a lot of detail, but they tend to focus on one outcome or one type of outcome in any one study. So looking at insurance policies, subprime lending, mortgage acceptance rates, racial composition. And then there's some that's looked at more kind of health outcomes and other types of outcomes in these cities. But again, it's usually been looking at a small subset or one type of outcome. Okay, so we wanted to try and get a bigger picture view of what is this correlation between these historic redlining policies or these areas that were redlined and outcomes in cities today. So we picked 14 case study cities to try to span the US geography from East Coast to West Coast, some in the middle, but also differing degrees of kind of this qualitative understanding of the degree of gentrification in some of these cities. And then some just because we were curious about them and happened to live close to them, like Detroit. Okay, so then we looked at different variables and some different data sources to try and get a picture of quality of life and outcomes in these different areas. So from the CDC 500 Cities project, we had things like chronic heart disease, diabetes, and obesity. And then we had behavioral types of outcomes. How many people get annual checkups? How many are regular smokers? How many people, what fraction of people have no leisure time physical activity? And then from the ACS, the American Community Surveys, we had measured percent below the poverty line, unemployment, high school graduation rate, percentage without health insurance, identified only as white, and use public transportation for work commuting. So trying to capture a range of what's going on in these areas. So just thinking through the data, right? So the redlining happened in the 1930s. And this then eventually the Supreme Court struck this down, but it was still reflected in some of the follow-on policies that were weaker, but still quite discriminatory. Then we had gradual lessening of the degree of arguably gradual lessening of the degree of discrimination in housing. And then we have our data from 2015, so quite a while after that. Then the question is, well, how much is that redlining reflected in outcomes that we see today? So here's an example. This is chronic heart disease in Detroit. Okay, so we have CHD is chronic heart disease prevalence by census tract. So you can see there's quite a bit of difference. And just one point here, Highland Park and Hamtramck in the middle, those are not part of Detroit. They're these embedded small cities. Okay, so if we look at the homeowner loan corporation areas, right, we have our green areas, and then we have our red areas. So the red areas are those that were redlined. And if you were in a redlined area, it was nearly impossible to get a mortgage. That is, you could not get a federally backed mortgage in these areas, which means you probably weren't going to be able to get a mortgage. So it really suppressed development in these areas. Okay, so we have a problem here in that our spatial units don't match, right? So we have our outcome variables at either the census tract or the census block. And then we have our homeowners loan corporation neighborhood boundaries, which are somewhat irregular, and we have to match these together. So we overlay them, and then we start to find the smallest common units and record those. And then this becomes our unit of analysis, right? So then we do that, and this is what just for CHD, chronic heart disease, looks like in Detroit, Michigan. Now, Detroit by land area is one of the bigger cities in the US. Okay, so now we can start to compare the distributions in these neighborhoods. So this is percentage of residents as an example with chronic heart disease in Detroit. And you can kind of look at this and say, okay, well, the yellow and the red, at least the mean is higher than it is in the green. So it looks like we have a higher percentage of residents with CHD in these red and yellow areas. We can then look at something like high school graduation rates, and this is in Atlanta, Georgia, and it's much clearer here, right? So that the redlined areas have a much lower percentage of residents who graduate from high school than those green areas. It's a really substantial and large difference, and the blue is much closer to the green, and the yellow is kind of intermediate. Okay, so now we can start to look across all of these cities and ask, well, what do the means look like as a starting point, right? So if we look at chronic heart disease, the red dots are the redlined areas, the mean of the redlined areas, and the size of the red dot is proportional to the standard deviation. So in almost all of the cities, the red dot is on the right, in some cases by quite a bit. So you would think, okay, we likely have a higher rate of chronic heart disease in the redlined areas in nearly all of these cities. For Detroit, the yellow is actually a little higher. We can look at high school graduation rates, and in most of the cities, nearly all of them, the high school graduation rates are lower for the redlined areas, in some cases a lot. Like if you look at Los Angeles, it's below 60% versus about 95% for the green-lined areas. So we're starting to see that there are systematic differences. So we said, okay, well, let's do some regression to try and look across all of these areas, and it's a pretty simple regression. So we trained for each city and each outcome for a particular outcome variables. For example, has diabetes, percent with diabetes. We trained a regression model to look at it as a function of being in a redlined area versus not. So XA is if you live in a green neighborhood, B is blue, C is yellow, and the default intercept is D for red. Okay, so what we do then is we look at these influences. So this is judging the outcome versus the the redlined area. So if you look at the upper line, for those areas that were green, this most desirable category back in the 1930s, CHD is arguably lower, smoking is lower, diabetes is lower, the percentage with no leisure time physical activity is lower, the percentage with no insurance is lower, percentage with obesity is lower, percentage living in poverty is lower, percentage using transit is lower, unemployment is lower, high school graduation rate is higher, and they tend to be more white. So this is those green areas versus the red line areas. And you can look at the blue and the yellow versus red line. But there's a very clear difference across all of these, almost all of these variables, and across almost all of these cities. So it's a pretty consistent message that the areas that were redlined see worse outcomes today across all of these different variables. So of the outcomes that are lower in the redlined neighborhoods, high school graduation rate was lower in 88% of them. There's less whites that live in these areas, and the number of people that get regular checkups was lower in about half of them. The outcomes that are higher in the red line neighborhoods are poverty, smoking, no leisure time physical activity, transit use, people that don't have health insurance, obesity, diabetes, unemployment, and chronic heart disease. So again, we see a very consistent pattern across quite a diversity of US cities in terms of size, geography, degree of gentrification, and lots of other things. So why do we do this? Well, because we want to understand that relationship between what we saw in the past and what we see today. And can we find exceptions to this pattern? And if so, can we learn from these exceptions? So we can find a city that's broken out of this pattern. What did they do to do it? And is that something that's replicable other places or not? So that's partly why we're trying to do this, and partly is to help understand what these relationships are. Okay, so I'm going to now transition to a very different study. And this is looking at COVID-19 pandemic's impact on online sex advertising and sex trafficking. So this is work with Julia Coxon, was the PhD student who did this work. She's now a professor at West Point. Bridget Carr is the director of the Human Trafficking Law Clinic in the law school at the University of Michigan. And then Vanessa Castro and Glenn Bredin were students working on this as well. And this is now under revision for publication in the Journal of Human Trafficking. Okay, so if you're not familiar with human trafficking, it's really a form of modern slavery. And in the US, it's defined by force, fraud, or coercion. And there's a lot of misperception around what human trafficking is. It doesn't have to be somebody who's chained and restrained, right? It's often fraud or coercion that keeps people there. So for example, document confiscation, that, okay, you have to do this thing for me or I will not, or I will turn you into the authorities and keep your documents. So you become then an illegal person in the country. So it's estimated, and these estimates are really, really loose, but it's estimated to be a $150 billion global industry that affects about 40 million people. But again, these are really, really rough estimates because this isn't something that's easy to measure. So major research challenges are ambiguity in the data, very inconsistent policies throughout, even just within the US across the states. It's often conflated with other crimes, particularly on the sex trafficking side of things. And we have a lot of just lack of information about what's actually going on. So there's also a challenge that combating sex trafficking is not straightforward. And I need to be clear here. There's sex trafficking and labor trafficking. We often present them as two separate things, but there's also an intersection, which we'll talk about. So when we think about sex trafficking, commercial sex legalization is one approach to doing this, and some countries have done that. Commercial sex decriminalization is a different approach where it's not made legal, but you don't prosecute the crime. In the county that I live in, Washtenaw County in Michigan, is the first county, as of January of this year, became the first county in the US to fully decriminalize commercial sex work. So we're living through an experiment now. There's partial decriminalization of commercial sex. So this is more like what some of the Nordic countries do. So for example, in Norway, where I'm also a professor, they outlaw the purchase of commercial sex, but not the selling of. And then there's things that like Seattle's done and some other places to try to reduce the demand for commercial sex. Okay, so you may have heard these things when the Super Bowl comes around every year, that there's this idea that the Super Bowl somehow increases sex trafficking in the city in which the Super Bowl happens. So we call this the Super Bowl myth. We've analyzed Super Bowl data and we cannot find any clear signal that the Super Bowl increases sex trafficking in that city. And we'll talk a little bit more about what data we're actually using here in a minute. But sex trafficking also, despite the word trafficking being in the name of it, does not have to involve movement at all. You can be trafficked out of your own home. You can be trafficked within your hometown. So it does not have to involve movement. That's one of the misperceptions. One thing when we talk about the data is that third-party management is a proxy for sex trafficking. So some of the work with the Super Bowl has used what arguably are some not great proxies for how to detect sex trafficking in the data. Okay, so the research questions that we are trying to address is, because we started this early in the pandemic, or did the pandemic have a measurable impact on online advertising associated with commercial sex and with sex trafficking? If so, what changes do we see? And where might things be going in the future? So if you're a policymaker worried about this, you might have some idea what you should be thinking about. Okay, so where do you get data to study this? The internet, right? Commercial sex work depends on being able to sell the services either of the traffic victims or of the commercial sex worker. So they have to advertise. So if you go to certain websites, you can then scrape data. So these are two ads. One on the left is one that we would flag as a commercial sex advertisement, likely not involving sex trafficking. We don't know for sure, that it doesn't. But if you look at it, it's got characteristics that suggest that this is a voluntary commercial sex worker. The one on the right is one that you would say that's pretty likely that involves sex trafficking, just in terms of the way it's phrased, in terms of some things that are not there, and that phone number. That phone number is associated with an awful lot of ads across the country. At least it was at the time this was posted. So that gives us an indication that there may be third-party management, that there's some call center that's been making appointments for likely victims around the country. Okay, so we scraped a few of these different advertising web pages, and the one that we're using in this study is Rub Ratings, which is a web page you probably don't want to go to, but we were trying to use it to get a sense of the advertising that's out there. So we scraped from January 2020 to September 2020. We had over 1 million advertisements. We deduplicated, so that got rid of about half of it. There's a lot of duplication across posts. Then we also quickly realized that we had some scams in there, that there's some that don't list a phone number, and we weren't sure what those were. So we created a dummy email address, did not use my Michigan email address, emailed them, and quickly realized, well, they're just trying to steal credit card information. So we got rid of those. So now we're down to just those with a phone number. And then in the literature, there's some people that have looked at different ways to try to distinguish indicators of trafficking, that is ads that likely involve trafficking, from those that likely do not. You can never say for sure. Some people use movement as a proxy for it, but that's a misinterpretation of what trafficking actually is. Trafficking is not defined by movement. It's defined by force, fraud, or coercion. So instead of that, we used an indicator of a third-party management. And this was based on meetings with FBI, HSI, and victim advocates to try to understand what is it that we could untangle from these ads. And across the board, they said, okay, well, if there's a call center that's managing it, that's likely a pimp who is then the one who is arranging for this person to go meet other people. So, okay, we took the one-to-one ads out and said those are likely not commercial sex, or at least we can't say they are. The one-to-N then gives us about 369,000 ads. And then we aggregated, and we had a few missing days, because scraping these websites is also a challenge in itself, because they would prefer not to be scraped, and they were actively trying to block our scraper. So we'd have to keep adjusting to get around their security measures. Okay, so we then plotted these. So the first thing we did was plotted the time series of these ads for different cities. And then we normalized. So we normalized to the pre-COVID ad count. So we normalized to this period out here before the stay-at-home orders started going into effect. And the stay-at-home orders were coming in right when we see this big downward trend. So when COVID first hit, and this is, to be clear, this is 2020. So March 2020, when COVID first hit, the ad volume decreased substantially in all of these sites. And then it increased, and in some cases increased far above where it was before. So we look at this dark blue line, which is Houston. It's more than double by last September, more than double what it was pre-COVID. The yellow line is Seattle. Seattle is 1.5 times as high. Everything is higher than it was pre-COVID. So we see this dip, and then we see it come back up. So then we started to ask, okay, well, let's see if we can now untangle this from the likely commercial sex ads from those that are likely sex trafficking ads. And then we looked at by city, and we looked at different periods, and we did an anomaly detection and said, okay, are they different before and after the at-home or stay-at-home orders were implemented? And then are they different after those stay-at-home orders were lifted? So for example, if we look at, let's pick Miami, Fort Lauderdale. So the third one from the bottom, all ads go down. And they're statistically significant across. So we did 12 different window combinations to compare before and after. All ads go down. Once it's lifted, there's not a statistically significant change in the ad volume. If those flagged ads, so this is the third column, those are the ones we flag as likely involving sex trafficking, that goes down. The flagged ads go up after the stay-at-home orders are lifted. The independent sex worker ads go down. And they go up, but it's not as clear that they go up as with the flagged ads. And we see this kind of across the board, that after the restrictions are lifted, the flagged ads go up for all cities and almost all combinations of lead and lag times. For the independent sex workers ads, or at least what we're interpreting to be independent sex worker ads, they don't necessarily go up for all cities. If you look at Detroit, Seattle, and Chicago, the differences are largely not statistically significant. So you can see that there's a difference in how what seem to be independent sex workers reacted, which is more cautious, not going back to advertising and necessarily working, versus flagged ads, where it goes up. So this points to a lack of agency on the part of the ones in the flagged ads, that they might not have the ability to not be working. So when we think about the impact of the pandemic on sex trafficking, it's a really complicated social economic system, because we have things like the CARES Act, which explicitly exclude people employed in certain types of activity, including those of prurient nature, I think was the term they used, which means commercial sex workers. So they're excluded from the benefits of the CARES Act. So their livelihoods decrease, and they don't have this recourse of how to recover. We also have potentially more people made at risk because of changes brought about by the pandemic. So we have the risk of there being more trafficking victims. And then we also have challenges associated with the pandemic, because public health surveillance really depends on trying to understand where spread is happening. And in an activity which is illegal in most of the US, it's going to be really hard to do that kind of surveillance and monitoring, which then puts the sex workers at potentially even higher risk. And then layered on top of this, we have this ongoing discussion of decriminalization, and it's happening in a few places, but not very many. Okay, so when we think about our research questions, did the pandemic have a measurable impact on online advertising? Yes. Have rates fallen? Yeah, they did when the stay-at-home orders took effect. And there's multiple reasons why this might be, and the reality is probably a combination of these. One, there's been some interesting studies that others have done of looking at, well, when are illicit massage businesses most busiest? And the answer is noon. So it's people coming from work. So if people aren't going from work, the demand has likely fallen. So one possible explanation is, well, advertising is following demand. Demand goes down, why pay to advertise? Another explanation is well, that's part of it. And then the other is potential risk is keeping people home. But why did they increase? Well, it could be that they're trying to drive demand with advertising. So they're out in front of demand, or it could be in response to demand to try to attract them to their particular location. So when we think about this, we have to be really careful, because vulnerable populations are made more vulnerable through the pandemic. In particular, some of the federal response has excluded support for some of these really vulnerable populations. And there's some suggestion that they're going to be more at risk of falling into trafficking. Okay, so that was kind of the second case study. Third case study is coming back to this idea of natural hazards, and particularly community resilience. And this is work with Tom Logan from when he was a PhD student with me. So when we think about resilience, we often hear resilience talked about either in terms of infrastructure. So if you think about kind of the classic engineering approach, you've got your resilience triangle and how quickly can you get the main infrastructure restored. Or we hear about things like SOVI and things like that, and the more human side. But when we really think about it, resilience is fundamentally about people and what they need to survive, return to normalcy, and ultimately thrive and achieve their full potential. So I would argue both that engineering approach and more that social geography type approach, both of them are important, but neither of them really gets at the core of the issue. And we have to be really concerned with inequities in resilience. Which subgroups lack resilience, and resilience in what ways and why? How does this impact them over the long run? If we think back to Hurricane Katrina, we've seen substantial changes within some areas of New Orleans because they lacked the access and the resilience after that event. Individual behavior also matters at the macro scale. What businesses and households do can impact the resilience of the overall community in ways that are really difficult to predict up front. I'm not going to talk about it today, but we have a whole other set of research on using agent-based modeling to try to understand how these individual level behaviors roll up to resilience of the overall system. Okay, so we also need ways that we can study this with open source data, because communities need to be able to do this without being dependent on really expensive consultants or others. Okay, so like I talked about, there's kind of two dominant views of resilience in the literature. One is kind of focused on really adaptive capacity, and this is grounded in a sociological geography perspective. And it really focuses on trying to measure things that correlate with the community's ability to adapt or to provide estimates of vulnerable subpopulations. There's usually little connection between this and kind of key services, thinking water, power, education, things like that. Then we have the more engineering infrastructure type of approach. And my background is my first 3 degrees were civil engineering, then my PhD was operations research. So a lot of this type of approach originally comes out of civil engineering. And it really focuses on critical infrastructure because partly that's what civil engineers know, and they're really important, right? Water, power, transportation, things like this. But it's usually done at an aggregate community-wide level. So if you see your recovery curve and your resilience triangle, it's usually percentage of customers restored on the y-axis or something like that, a percentage of demand met. And this doesn't usually pay a lot of attention to the spatial detail or to specific subpopulations or to things that aren't served by the critical main infrastructure systems. Okay, so just a couple examples. Many of you have probably seen SOBI. So this is just SOBI plotted from Cutter's work. And then we see this resilience triangle. This is from the People's Framework from 2010. So what Tom and I did as part of his PhD work was try to come up with a more integrated view. And we termed this the equitable access to essential services. So our view is that resilience is fundamentally about equitable access to essential services as essential services are defined by the community, and as before, during, and after a disruptive event. We're not trying, when we talk about a resilient community, we're not trying to just get the critical infrastructure back to where it was before. We're not just trying to increase their adaptive capacity. We want to look at their access to what they deem essential and how that changes over time. So the means of gaining access is not the critical part. Access itself is. And we really want to focus more on vulnerable and disadvantaged populations and drive this down to the household level. So we want a pretty fine-grained measurement of community resilience. Okay, so this brings up then a whole other question, which was what is access and how do we measure it? So there's been a lot of work, particularly in access to healthcare, in terms of how do we measure access. So the traditional aspects of accessibility are proximity, how close are you, the availability, the acceptability, the affordability, the adequacy, and then more recently added awareness. Right now, we're going to focus on proximity versus traversable paths. That alone is necessary, but not sufficient, because if people aren't aware, then it doesn't matter that they could get there because they won't know to go there. If it's not adequate for their needs, they could get there, they might be aware, but it's not going to meet their needs. But right now, we're going to focus on proximity as a starting point. So when we think about how access is often measured in urban areas, it does typically focus on proximity, and it usually often uses large spatial units like census tracts, rather than trying to get down to that household level. And often there's these arbitrary thresholds that are used. For example, if you're within 400 meters of a park, you have access to green space. And sometimes they even use Euclidean distance rather than a routed network distance, and don't differentiate by travel type. Okay, so we developed a way to try to measure access at the scale of any city in the US, so pretty large scale. And we want to be able to distinguish by travel mode, and we want to do it at the household level. So there's really kind of 4 key steps. One is the input data. So we want to use publicly available data. So we're using OSM. You can also do it with Google, but it costs quite a bit more to scrape Google than it does a free source like OSM. You need to define your points that you're interested in, right? Access to food, so grocery stores, access to hospitals, schools, other things like that. And then we use an open source router to keep this open source. So we've also done this with Google through their API. And then we can do it by travel mode. And then we apportion the demographics to downscale from the block or block group level to get down to a finer scale. Okay, so what does this look like? So this was a paper that was published in a planning journal a few years ago. And this was looking at access to green space. This wasn't the resilience project. This was just saying, can we measure access to green space and look at differences? So on the left, we see 5 cities where we assess the access to green space. And this is the proximity in terms of walking to green space. So the big city in the middle is Los Angeles, and you can see you've got large areas that are in a quote green space desert. That is, you're quite a ways from any green space. If you look at Baltimore and the left, and I lived in Baltimore when we did this, you can see that it looks better, right? There's better access to green space. But then we can start to distinguish by race and how safe is this green space. So we did this, and rather than setting an arbitrary threshold, if you're within 15 minutes walking, you're fine. We said, okay, well, let's look at the percentage of the population that is within certain amount of time of walking, right? So if we look at Baltimore, the yellow line, we can see at 10 minutes walking, about 85% of the population is within 10 minutes walking of green space. So that's pretty good. Chicago's better, Seattle is better. And then if you look at the spread, right, if you look at Atlanta, the non-white population is the dashed line and the solid line is the white population. So in Atlanta, the white population has a much better access to green space than the black population. Then we could start to distinguish, is it safe or not? Because you might have access to green space, but not want to go there because violent crime is high. So we got violent crime data from the FBI, which is a whole other issue in itself that the students handled really well. And then we asked, okay, is access to safe parks, those with violent crime rates below a certain threshold. And you can see the difference between black and white and non-white populations grows in Atlanta, and it grows in the other cities, but Atlanta grows quite a bit. So you can see that there is a difference if we ask, do you have access to safe parks versus just access to parks? Okay, so fine, that's about resilience. We published a few papers on this, that's on access, but what about resilience? Well, we now have a computationally tractable way to measure access to any given kind of point service. Could be a school, a hospital, a food source, a fire station, a park in a city. So now we can extend this to account for transportation system damage, right? So if you get hit by a hurricane or an earthquake, we can account for water, power, and other centralized services and their impacts on both the households and on other point services, right? So if I'm interested in access to schools, if my school doesn't have power, it's probably not going to be open. So it doesn't do me any good to have access to it. And then we can look at building damage, and then we can simulate future events. So let's talk a little bit about then that power side of this, because again, we want to do this on publicly available data. So we published a paper late last year where we developed a way to estimate power system performance based only on open source data, because that's one of the challenges. I've done a lot of work with power utilities developing power outage forecasting models, and they all use a lot of data from that utility. We wanted a way that we could run this type of a model for anywhere in the US and to do it at the household scale. So what we do is we first build a synthetic network to provide service to all the buildings. That is, we physically route the lines, put in poles, put in transformers, starting from the substations, which are publicly accessible. Then we use a machine learning algorithm to designate if lines are overhead or underground, to assign fragility curves to each asset, and then we can simulate the hazard, a hurricane, a windstorm, a flood, whatever it is. And then from that, calculate building level service availability based on the system state. And we have a paper that was just accepted at a conference to then say, okay, now let's simulate the restoration process, again, using only publicly available data so we know how long power is out at each of these buildings. Okay, so once we can do that, we can get building level power outage estimates. And now we can look at access. And this was a case study where we looked at access after a particular event. This was Hurricane Florence, and we looked at access to grocery stores. So this is in Wilmington, North Carolina. And Tom did a lot of work to understand when each grocery store was open and closed, meaning he just kept calling them and looking at web pages. And then we looked at access over time for different parts of the city. So that figure at the top right is the distance to open supermarkets over time, right? So on the 16th of September was when we had the big decrease. And then it started to come back 2 days later. We're back up and our access isn't quite as good as it was pre-event, which is the 8th of September, but it's getting closer. And then we can plot this over time, and that's what's on the lower right. So we can start to get a sense of, well, are there parts of the city that don't have access and don't have access for a prolonged period of time? Because those are some of the areas we might need to provide more support to in the short term. And then in the long run, if they're just areas that are living in a food desert, well, maybe that's something we need to think about more generally, aside even just from hazards. So when we think about the big picture, kind of looking across to all of these different case studies, we do have inequity that exists in US urban spaces. We see it in the redlining studies, we see it in the resilience studies, we see it in the impacts of the pandemic on commercial sex workers and those that are voluntary commercial sex workers versus those that are potentially human trafficking victims. And we have to consider the impacts of policies and decisions on those most at risk. That is, we're going to take interventions. We can't just look at an aggregate what happens. What are the impacts of those policies on those that are most vulnerable and least able to respond to those changes? Some of these impacts may be multi-generational. When we look at some of the impacts, for example, of the tsunami, the 2011 tsunami in Japan, we see fundamental changes in the structures of these communities that are going to have impacts for the next 100 years. They're fundamentally changing where people live and how they interact with the ocean, which is their main source of income in these fishing communities. And that's going to have fundamental changes on those communities over time. So we've done some studies on tsunamis. If you want those papers, I can get you those. Disruptive events such as pandemics and natural hazards can have really different impacts on the abilities of individuals to respond. Right? And this is what SOBI's trying to get at, which is the ability of individuals to respond to and adapt. And SOBI is a really important measure, but it's still at a pretty aggregate scale. How do we drive this down to a much finer scale so we can understand, well, who's most likely to have to adapt and respond? And do they have the resources to do that? These spatial and temporal inequities can be measured, but both before the event, right? So we can look at, for example, the existence of food deserts. There's a lot of research on that. That's without a hazard happening. Then you look at, okay, what are the impacts of the hazard on food deserts or access to education? Or we're doing a study now in Puerto Rico, and one of the issues there is elder care, right? So this is very community specific, and we need to have the communities defining what's essential to them rather than having us as engineers say, it's all about the centralized water system and the power system. And we really need a more complete risk-based framing of inequities in these urban spaces so that we can start to think about improving how we model and measure and deal with this. So I'm going to stop there and left some time for questions.
Thank you, Seth, for the informative presentation. Any question from the audience?
Hi, Seth. Fred Woodham.
Hi.
Great seeing you again.
Good to see you.
Terrific work, as always, right?
Thank you.
If it wasn't terrific, I'd be disappointed. But so one of the things I think that's very, very, first, what you did is super because we need to dig in and understand more what's happening, where are the relations. But I think one of the really difficult things is that so much of this, we'd love to get to causality, right? So we know where the cause and effect levers are. But a lot of it ends up being heavily correlational, right? The fact that poor communities are already in crime-ridden areas. And so them finding green space that isn't also crime-ridden is very hard. It might be very interesting actually to find out where the access to green space goes against that trend, so that the green space is safer than your neighborhood. I mean, I think those are kind of, but you've started the work, and I think those things can go down. Now that I'll tell you the other thing that's really challenging, and this is from the work that I got to do in suicide prevention, is the old physician dictum to do no harm. And a lot of times tend to lead with the intervention and just not always have a good understanding of the cause and effect. And we end up doing things that are more harmful. And so your little diagram where you're stacking the boxes so the little short person can look over the fence, maybe the do no harm is saying, the boxes tip over more easily when you stack that many. That's a silly example, but I think that's where I think once we understand the correlations, great. Let's now understand the causality so that we can fundamentally change the inequities, as you said, instead of just stacking boxes and they can look over, but are they actually really able to fully participate? Anyway, great work.
Yeah, well, thank you. And I definitely agree that we need to start getting at and understanding that will help us understand the effects of interventions. And I didn't talk about it here, but we've done a series of papers on the tsunamis in Japan and looking at this idea of the Levy effect. So I'm a natural hazards guy. I like modeling natural hazards. I don't like natural hazards. But this idea of the Levy effect is that, okay, you build a levee and that changes people's risk perception. So more people move in behind it, you have more development behind it. And then if you get an even bigger event, a black swan event, or it doesn't even have to be a true black swan, now you end up with more damage than if you had not built a levee in the first place. So there's been a lot of qualitative studies of this, but this is one where well-intentioned engineers say, yeah, I can build a bigger levee, so I'm going to build it. But in the end, it actually can make the community much worse. So we have a paper, Nature Sustainability, on this that might be worth checking out. That's in the hazards context. Yes. When we start to look at this issue of causality, in particular this paper on redlining from Journal of Applied Geography, was a really interesting back and forth with the reviewers about causality versus correlation. And we ended up, it took us a long time to get this paper published because we ended up doing a deep dive into the more theoretical literature on redlining and community planning to try and understand better what's known qualitatively about causality, because you're not going to get there quantitatively.
Yeah.
So it was a really educational experience both for the PhD student and I, and a very slow paper for her first paper, but it was a good one.
A good one indeed. Thank you.
Thanks.
Thank you, Kathy. Kathy, please go ahead.
Yeah, Seth, that was a really interesting talk. Can you hear
Thanks.
me? Can you hear me?
Yeah.
I'm sorry. Yeah. Can you hear me now? Okay.
Yep.
Yeah, that was a really interesting talk, and thanks very much. I also wanted to ask you, or to point out that I saw an interesting study back in the summer of 20, where somebody overlaid COVID death rates with redlining maps. And it was really fascinating. I don't even remember now what city it was or who did it, but I don't know if you've looked at any of that at all. We
haven't. It would be really interesting to see, though, because you would expect, I would expect some clear correlation there for a number of different reasons, but it would be interesting to see. I should go find that study. If you still have a link,
if I can find it, I'll send it to you.
Okay.
Then the other thing I wanted to mention about redlining, it isn't directly related to your study, but a lot of, when they put the interstate highways through, they tore up a lot of the old redlined neighborhoods and basically disrupted the social fabric of the neighborhood, because all of a sudden there was a highway going through and you couldn't cross over to see your neighbors anymore. And it made things a lot worse. I don't know if any of your, if you could take account of things like interstates being built through your neighborhood in any of your analyses.
Right. So the access stuff, our access was based not on a spatial proximity, but on an accessibility on the network. And there's some really interesting examples. So we started off doing this work in Baltimore. So I lived in Baltimore at the time. And on the west side of the city, there was one of these interstates that was plowed through a neighborhood, and then it just ends. So it's not even a very useful interstate that divided the neighborhood in half. And yeah, once you start measuring access by actual ability to get there rather than just how Euclidean distance close you are, it makes a huge difference, especially if you're around some of these interstates that push through some of these communities. Like I might be able to look out my door and see a beautiful park, but I might be a mile walking from it because I have to go so far around because of this interstate. So yeah, that makes a big difference when you start to measure access.
And thanks again. It was a great talk.
Oh, thank you.
Thank you. There is another question from Matthew. Matthew, do you want to unmute yourself, or I can read the question?
I can read the question here. Okay, have we found any cities that have managed to improve their outcomes? So this is where we started this study, and why we picked such a wide range of cities, of different types of cities, to try to see if we could find some that have kind of broken out of that mold. Not many. And that's part of the challenge, because we really were hoping to find some so we could then ask this question, well, how did they do it? There's some hints that some of them have to some extent on some of the outcomes, but there's none that it's like suddenly they've reversed the impacts of the redlining across all the outcomes. I think Portland has had some progress in some of the outcomes, and what's the other one? Asheville, I think. Asheville was included partly because that's where the PhD student was from and she wanted to see what it looked like. But it's actually an interesting case study in this as well. So no, we don't have a really clear city we can point to that says, okay, they've reversed this problem, which is we were kind of hoping to find that. We had this hypothesis that we would find one, or hope hypothesis. I'm not sure where we were on the spectrum, but no, we didn't find one to entirely get us out of that.
Thank you.
Good question.
Any other question? From students?
And then just one thing I would say for the students, and your advisors may or may not appreciate this, but you can do research on a really wide range of topics, right? I mean, you saw what I presented, and it was, I don't know, my department sometimes accuses me of being all over the place, but that's part of the fun of being a researcher, is we can dig into lots of different topics and try to understand them.
Thank you, Seth. So I really like that you try to elaborate on the definition of resilience by bringing accessibility and equity, not just how quickly we go back to normalcy. So another perspective for defining resilience is, okay, so we observe this failure, the natural hazard happens, and then we bounce back, right? No matter what the strategy is, that's the goal. And then we learn from it. So we pivot and maybe we are able to bounce forward.
Right.
So from your perspective, if you want to add that to the definition, how the quantitative component would change.
Right. I would say we're trying to base what we're doing in that idea of ending up better off than you started from. Right. So if we can measure the pre-event access and find those areas where we have poor access, and now we can break it out by type of essential service, right? So access to food, access to water, access to healthcare, childcare, et cetera. If we focus in on those populations that have poor access before the event, as we recover, can we do things to improve their access so they end up with better access than they started with? So I would say we drive it down to a neighborhood level and try to get that access improved for those areas that most need it. And this is, I think, one of the advantages of trying to do it spatially. Disadvantage is the computational cost, but hey, that's a minor thing. So yes, I would say what we're trying to do is bounce forward in a targeted way so we can help those who most need it in the long run.
Great, thank you. Any final question for Seth?
Well, thank you all for inviting me.
Sure.
Oh.
John, go ahead.
Oh yeah, I was going to ask about the synthetic data that you had for the power systems, and is there any? Do you have any sense of how accurate it is, or you said you could maybe compare it to maybe you have access to data for a specific place, and then also just like side comment, I appreciate the comment about wide opportunities for research for the students. Thank you for that comment. Yeah.
It's part of the fun of being in OR and risk, because we can work on lots of stuff. So to your question about the synthetic data, yeah, so what we did was developed an algorithm for creating a synthetic power system. And then we compared it to the real power system with one of the utilities where we actually have the data. So we compared the layout. We put a line there. Did they put a line there? We put a line there, and it's overhead. Is theirs overhead or underground? The real thing. And then we also compared our estimated outages for an event with the real outages for an event. And there we had some spatial mismatch in the outage data we got with so we were estimating at the household scale. We got somewhat aggregated data. But yeah, on the layout side, it is, so we were looking at essentially line distance from a substation to a house, right? Because that's a critical parameter in the distribution system, which is mostly radial, because the further you are, the more chances you have for a break to happen. So we looked at that line distance, and it worked out quite well in most areas of the city. And then we looked at some other measures of the network itself and just other things, and it seemed like it works quite well. And then in terms of the outages, it matched well with the data we had. Part of the challenge is we were doing a derecho, so a really big wind event is one of our events, and there just the wind data itself wasn't very good at the spatial scale we were trying to work at, because we don't have enough weather stations in US cities. So we had a challenge comparing, just because we were driving it with wind data that was highly uncertain.
Great, thanks.
You're welcome.
Thank you. Any other question? Okay, I don't see any. So please join me and give a round of applause for Professor Guikema for this great presentation. I hope you all enjoy the rest of your day, and happy Friday. Thank you.
Thank you all for coming.